Good morning, Mama. How are you? How is the baby?
Maybe it's not fine.
So we are going to put some eye drop for the baby. But first we are going to clean it. So in case of anything, you have to make the baby comfortable as well as you are. So I'll provide privacy. Put on gloves. This one is to protect the baby and me. So this one is we clean from up out this cut once, and then from down here on this cut, and then we clean from here out this cut, then we get from here down and we discard. So in the medicine we have to first look at the name of the drug and the expiry date. And then you also go and confirm with the senior staff that is in the ward. So this one we're going to give the drop. So the drop is we are going to protect like 1, 2, then we clean this card, we get another one, then we put 1, 2, then we clean. So take the thing back. So Mama, you have already cleaned the baby eyes. So thank you for your cooperation.
Okay. Thank you too.
You're welcome.